screen. So how this will happen, like every other webinar that I've had, I'm going to speak for some time and then I will open it for questions. And I had sent an email to all of you asking if you had any questions specific to brain health and blood glucose related. So I am going to get started with my screen share, and you may even type your questions in the chat box if you, or you can raise your hand and um, I can let you speak. There is no video, so you can feel free. You don't have to show your face. 1 minute, where am I? Okay. So this is optimal blood glucose levels. And if you remember last month when I talked about optimal numbers for brain health, I did talk a little bit about optimal blood glucose levels as well. And so the reason is that is one of the most important factors for your brain. So when it comes to blood glucose levels, so this is just a recap of what I talked about last month. So you can see this long list. Of course, this is not the complete list. This does have some of the commonest numbers that you need to know when it comes to your brain health. But at the same time, is this everything? No, definitely not. But this is a very good place to start. So when it comes to brain health, in the ideal world, what I would really like to do is, number one, of course, your medical history is extremely important. Then your basic blood work. Next comes for brain particularly, one of the major things is brain imaging and also neuropsychiatric testing. Now, neuropsychiatric testing is not easily available everywhere in the world, and I'm not trained in doing that. And brain imaging is also, it's expensive and it's not the right kind of imaging is not available everywhere. So bottom line is, then there are, of course, some newer tests coming up for brain, for cognition, which are some of them it's possible to do it online. And that is where I think in the next few years, that is, many of these are going to be validated, FDA approved tools. So I'm just waiting for that. So until that happens, number one is, again, all that I talk about here today is not to be considered as medical advice. This is for information only. And even if you're my patient, you need to talk to me one-on-one to find out what is applicable to you. And if you're not my patient, then all the more reason that you need to talk to your doctor. So these were just the basic ones I talked about. And as I have made it a point to call 2022 the year of the brain. And the first three things, blood glucose levels, blood pressure levels, and low levels of chronic inflammation, they are the foundations of brain health. So what do I mean by foundations? Now, you know that foundation means if you have those factors dialed in well, then you have a good start for maintaining your brain health down the line. Now, today, what I will talk about is not only cognitive decline and Alzheimer's risk when you are older. I'll also talk about, May is supposed to be Mental Health Month in the US. Not that May is the only time you should think about your mental health, but the fact is blood glucose levels have a very close relationship to mental health as well. And as if you've heard me speak before, you know that I talk about mental health and brain health kind of interchangeably, because yes, it is very important how your brain functions will also decide your mood. But most importantly, your body is a network of networks. So what happens in one area impacts everything else in all the other areas as well. So your brain is not independent of the heart, and your mood is not independent of brain health or gut health. So that is just a few things I wanted to talk about before I move on. Now, just this is again still recap from last month. I talked about glycemic variability. So how do you measure your blood glucose levels? And if you haven't, if you missed the last webinar or you didn't go through the recording, I will send it again with this recording so that you can just recap what I talked about then. So glycemic variability again is a number which you will only know if you do a continuous blood glucose test. So you wear a sensor If you just do a routine lab test, you go in the fasted state to the lab and you get your fasting blood glucose tested. And after 2 hours after meal, you go for your post-meal test. That will not give you your glycemic variability. But is that important for everybody? Maybe not, but what is definitely important, and a fasting blood glucose test is available anywhere in the world. And if you have a glucometer, those devices where use a lance to get a drop of blood and put it on the device and check, you can check your blood glucose levels more frequently than you would just going to the lab. So that is also important. That is another way of getting your blood glucose numbers, but each time you do have to do a finger stick. So that is again another way of doing. So I talked last, this is again from my last month's slides. I talked about glycemic variability and particularly the relation of food. You know that, in my world, food is medicine. So when you eat carbohydrate containing food, your blood glucose and insulin actually goes up dramatically and falls dramatically. Now, this is something I'd like you to remember, because I'm going to talk about something else a few slides down the line, which is significant for mood issues and brain health as well. Versus if you eat protein and fat containing food, they don't spike your blood glucose levels suddenly. It's a much more even keeled response, and it does not dramatically fall as well. So this is actually, if the only thing you went away from today was this, carbohydrates raise it dramatically and make it fall dramatically, protein and fat give you a more even response, then I would have done my job. So what is the relationship of blood glucose with cognition, with mood? Now, we know that people who have diabetes, whether it is type 1 or type 2, have a high risk of cognitive decline. In fact, their risk is more than 50%. So having diabetes itself places you at a high risk. But more importantly, many of you are thinking, I don't have diabetes, so why should I be worried about, what blood glucose does to my brain? That is what I want to highlight upon today, because we know that diabetes is a condition where you have very high blood glucose levels and they are controlled by medication and food and lifestyle. But what about those of you who have not been diagnosed with diabetes today? Your doctor says your blood glucose levels are climbing or they're higher than normal, but you don't have diabetes today. So I'll see you in a year's time. What about, such people? Are you at risk for long-term, brain cognition, cognitive decline? Are you at risk for mood issues? That is what I want to stress upon, because that is sometimes that a lot of people are not aware of that. Another issue is brain fog, and brain fog, given the ongoing, coronavirus pandemic, a lot of people have had what is called long COVID. So they have persistent symptoms for a long time. And there are about 200 different symptoms people have experienced. And brain fog is one of them. So basically how people describe brain fog is your thoughts are going through, something like jello. Now, jello doesn't translate everywhere in the world. So you feel your thoughts are not clear, and it's like your thoughts are going through tar or, jaggery or something thick like that. And you like sometimes it is difficult. I found many of my patients find it difficult to explain what is brain fog, but they'll tell me my brain doesn't feel the same as it used to maybe a year ago, or as it used to before I had COVID. So that is again something very important, because brain fog by itself, it's a symptom of something else that's going on. If it is a part of a long COVID, it is possible that it is because of inflammation. But even having widely swinging blood glucose levels can also lead to brain fog in many people. So blood glucose and mood is what I want to focus upon a little more today, because that is not something, even doctors, actually a lot of doctors are not aware of that. And of course, if doctors are not aware, how can we expect patients to know about it? Of course, unless you are someone who's experienced that and you have gone and researched that condition. So the two major factors are something called reactive hypoglycemia and relative hypoglycemia. These are two conditions that I'll talk about today a little in details. But before I talk about reactive and relative hypoglycemia, this is something I want to highlight, where I was talking about people who don't have diabetes. So this is a study which looked at younger people. So you can see these are people who were 28 to 32 years old. So an average age of 30. Again, they repeated their fasting plasma glucose at ages 41 to 46. And then they looked for, global cognitive functions. So they did a whole bunch of cognitive testing. What they found that if their fasting plasma glucose was more than 5.6 millimoles. Now, in some parts of the world, it is millimoles. In other parts, I'm sorry, that's a typo. That should have been milligram per deciliter, not mf, mg, 100.8. So basically, less than 100 was better. However, there are some other studies, and I have talked about it before, where probably a fasting blood glucose level of less than 90 is better. And remember, I'm talking about people who do not have diabetes. People who have diabetes may sometimes have a lot of symptoms if their blood glucose levels go down below 70 milligram per deciliter. So below 70 is below 3.9. That is a state of hypoglycemia, but that is a different story. I'm not talking about people with diabetes here. I'm talking about people who do not have diabetes. So if you think that I don't have diabetes today and I'm good with my brain, I'm not good, I don't have to worry about cognitive decline or mood issues, maybe you need to revisit that. So this is one study. There is another one. This one was even more recent. It came out in March. I had actually posted this on LinkedIn, I think. So basically, the point I want to highlight is, when should you start focusing on your brain health? Well, today is a good day. So it is never too early and it is never too late. What if you are someone older who's already feeling that maybe your brain is not functioning the way you would like it to? Is it too late for you? No, it is never too late. So next comes reactive hypoglycemia. So hypoglycemia means your blood glucose levels go below a certain threshold. And this is, again, what I want to keep repeating is, this is in people who do not have diabetes. So reactive hypoglycemia is a condition where your blood glucose levels drastically fall, which usually occurs 2 to 5 hours after taking food. So usually how patients describe it is, they eat their meal, and after about, and it varies. Some people feel after 2 hours, some people feel after 3 hours, some may feel after 4 hours. So between 2 to 5 hours, they feel a whole bunch of symptoms, and I'm coming to those symptoms. Now, some people do not feel the symptoms in relation to food because they have not really, looked at thinking of it that way, but they do experience the symptoms anyway throughout their day. So it is basically your blood glucose levels falling dramatically after food. And again, the time varies. And this is, again, another clue that your insulin carbohydrate metabolism may not be working well. So I have talked about insulin resistance before. How will you know if you have insulin resistance? Number one is if you have diabetes, if you have PCOS, if you have had pregnancy diabetes, or you have fatty liver, or you have been told that your blood glucose levels are climbing, or you need extreme exercise to maintain body weight, or your liver enzymes, SGOT, SGPT, or ALT, AST, depending on where in the world you are raised. Those are conditions, or you have high blood pressure. So primary hypertension, not all types of hypertension, but the commonest one is related to insulin resistance. So my point is, why I wanted to talk about reactive hypoglycemia and relative hypoglycemia is because a lot of you may be experiencing these things, and your doctor thinks that it's a mental health condition and you need to be on antidepressants, whereas the problem could be elsewhere. It could be with your food and what you're eating and when you're eating. So this is a very interesting paper. So I talked about reactive hypoglycemia, and this is relative hypoglycemia. So there is a little bit of nuance in the terms. So relative hypoglycemia is a condition where patients develop symptoms referable to any system of the body, and I'll come to the symptoms. This is a very interesting paper, where there is a relative drop in blood sugar level. So if you talk about hypoglycemia to any doctor, they will say your blood glucose levels need to be below 70 milligram per deciliter or below 3.9, depending on which unit is used. And in pregnancy, hypoglycemia definition is different. But this is not, your blood glucose levels may not fall below 70, but they may fall from what they were before. So it's not a fixed threshold. Below this is hypoglycemia and above this is you don't have symptoms. It's not that. It's different things for different people. And again, this is a paper from way back 1966, and relative hypoglycemia was identified in 1924. So this paper is available, open source. It's a PDF. And some of the older papers, sometimes it is so interesting to read because they read more like stories, versus present day papers are more logical and more objective and more, in that sense. But it's if you would like to read this paper, if you're interested in knowing more, this is something I would recommend. So remember that blood glucose levels may not fall below 70 if you're checking using a CGM or a self-monitoring of blood glucose with a glucometer, but you may still have those symptoms which are related to relative hypoglycemia or reactive hypoglycemia. Now, I'm going to keep this slide on for some time because you can see the list of symptoms there. What is number one? Depression, 60%. So Dr. Salzer went through 300 of his cases. This was way back in 1966. So how many of you have experienced these symptoms and your doctor says everything is okay with you because your blood glucose levels are normal, and all you need, because you have all these symptoms of depression, insomnia, anxiety, irritability, crying spells, you can see the list is long. And I have found many of my patients, they are recommended, antidepressant medications, first of all, if they have these symptoms, without actually being, checking whether it's a problem of reactive hypoglycemia. And I'm going to talk about, of course, I'm going to talk about how are you going to manage some of these conditions if you are experiencing them. So if in case you have experienced any of these symptoms or you're currently experiencing them, this is something important to keep in mind when you go to meet your doctor. So is it possible that it is not really a condition where, and because this is not a condition where antidepressant medications are going to help you, or any antipsychotic medications, or for that matter, psychotherapy either. So this is just a list of all the symptoms that are possible. However, I do want to mention that it's not like, for example, crying spells. Now, crying spells can occur even if you have low progesterone levels. And, so that is, again, in perimenopausal, menopausal women, that may be a feature. So it's not, the crying spells may not be the only reason for reactive hypoglycemia, but it could be related. And again, as you know, menopause is also related to blood glucose abnormalities in many people. So insomnia, the only reason is not reactive hypoglycemia. But the point is, so this may not be something you or your doctor is thinking of, and the fix may be quite different and not involve a prescription medication necessarily. So mechanisms, I'm not going to go into that. Of course, I know many of my listeners are doctors. So obviously you're wondering, what could it be that is causing all these problems? And I'm not going into that because I want to focus more on solutions. So diagnosis of relative hypoglycemia or non-diabetic hypoglycemia. Now, I keep saying I'm not talking about hypoglycemia in people with diabetes here. I'm talking about those who don't have a diagnosis of diabetes. And I have already explained this. Now, in papers like that 1966 paper that I quoted earlier, they made patients go through measuring their blood glucose levels after certain intervals over a period of 3 hours or something. But you may not even need such a test, because if you are experiencing those symptoms, what are the things you need to do? So one is, first and foremost, confirm what your blood glucose levels are. So if you have a glucose monitor at home, just check your blood glucose levels, because if you wait to go to the lab next morning, your fasting blood glucose may be absolutely normal. You may be feeling fine. You don't have any symptoms. At that point, it won't be diagnosed, because this is something that is happening at that point. So most important thing to remember is there may be no hypoglycemia. Your blood glucose levels may not be less than 70 milligram per deciliter, but you may still have these symptoms and you may still have relative hypoglycemia. Now, there are some other conditions, disease conditions I'm not going into. There are insulinoma, tumors, and a whole bunch of other stuff, which your doctor will know how to diagnose, or they'll send you to a specialist endocrinologist. But again, the most important thing to remember is most of these people, when they experienced all those symptoms, so in this particular paper, what he talks about is most of them were eating a higher carbohydrate diet and less of fat. And some of them had problem with caffeine as well. Now, as you know, I'm not talking in details about caffeine today, but caffeine can change your insulin and blood glucose levels dramatically. In some people, not in everyone. In many people, caffeine helps them, and in others, caffeine can raise your insulin and blood glucose very high. So you need to see what it is for you. And sometimes, of course, caffeine is in coffee and tea. It also depends in what form you're having the caffeine. Some people drink milk tea, particularly in India, and it's often the milk that raises blood glucose levels as well. So not necessarily the caffeine component, but the milk component does it. So high carbohydrate food, simple carbohydrates, less protein, less fat, and caffeine, these have been found to be the commonest problems. So amongst my patients, caffeine has not always been a problem. Sometimes it is, but high carbohydrate intake has a lot of sugary food has quite often been the problem. In fact, in the medical literature, there are a lot of case reports of, there's one case report from 2016 where a 15-year-old girl, and her diet history was very interesting. Granola bars and all the processed carbohydrates. And once she changed her food into real food of more protein and good quality fat, all her symptoms went away. So she didn't need any prescription medications. So this is, again, like I said, the most important slide for today. And here I'm going to pause. And if you have any questions, please feel free to raise your hands. So either I will unmute you, or feel free to type in the chat box, whatever works for you. And I am going to actually pause. Okay, so far I don't see any raised hands and I don't see anything in the chat box. So I am going to go ahead. So this is the most important part, because obviously you want to know, if you have this problem, what are the things you can do? Number one is, are you experiencing any of these symptoms? And I'm going to just stress upon those symptoms once again, because there's so many of them. And if you are experiencing these symptoms and there is nothing else that can explain your condition, and your doctor says that maybe you need to start an antidepressant medication or an anti-anxiety medication, this is probably a time when you do need to, of course, you need to check what you're eating at any time, but this is probably a time when you want to see whether it could be related to what you're eating. So if go do a review of what you eat. Are you eating a lot of carbohydrates? Now, maybe you are not eating processed carbohydrates, but I know many of my audience are, many of you are from South Asian countries. So your food is predominantly carbohydrates, a lot of grains, rice, roti. Some of you even love pasta, and then the flattened rice and the puffed rice, and rice in all its numerous forms. It is still rice. And particularly given the processing that the rice has gone through, the response in terms of blood glucose and insulin is very different today than what it was to rice years ago when the rice was not as polished. So it went through a manual processing. And similarly, it's not just rice, it is other grains as well. So if you have these symptoms, number one is do a review of your food. Are you eating very high carbohydrate? And as I have talked about before, what is high? Because high is a relative term. Some of you can tolerate a higher level of carbohydrate versus some others. My level is probably around 20 to 30 grams of carbs a day. 20 grams of carbs is one apple. So it is different things for different people, and it depends on, one is of course ethnicity, so your genes, but of course your environment, your physical activity level, what you eat, when you eat, how much are you sleeping. All those factors will decide what your, if you are someone who's very physically active, you will be in a position to tolerate more amount of carbohydrate than someone who's more sedentary. So if you have these symptoms, first go through your food. More importantly, if you have the ability to do your blood glucose levels at that point, you have a glucometer at home, go ahead and check your levels and see what they are. But remember that they may not be less than 70, so less than 3.9. So that is number one. Now, this is what I call the hangry monster. So if you eat, so let us say you eat breakfast, lunch, dinner, and here I've just added one set of snacks. It could be, some people eat 3 to 4 times. So what ends up happening versus if you're fasting, of course, your blood glucose and insulin levels don't go up. Now you can see the orange area is way bigger than the blue area. So if you have breakfast, and it is a very sugary or high carbohydrate breakfast, you have a whole grain toast with with butter and a smoothie and I don't know what else, then your blood glucose levels go up and then they dramatically fall. So you can see, this is I call this the hangry monster. You're angry and hungry very soon, and these look like the teeth of a monster. So that is the reason I've called it the hangry monster. Something many of you have probably experienced, but you probably don't know what it is, and you're thinking that, oh, maybe I'm just menopausal, that's why I'm feeling this way, or someone might have told you just getting older, get used to it. So this is something important to remember. So obviously, if you eat, like I said, the most important slide in my whole presentation is if you eat more of protein, because protein makes you more satiated, it doesn't make you hungry soon after. So it will not make you the hangry monster. And if you check online, you will find that the treatment for relative or reactive hypoglycemia, sometimes people will say you need to eat frequent meals. That is not something I completely agree with, because number one, frequent meals, I have talked about this numerous times before. Each time you eat, your insulin and blood glucose both go up. And you don't want that up and down. The glycemic variability I talked about earlier. So most importantly is you need to prioritize protein and good fat and reduce carbs. And caffeine, you need to figure out whether caffeine is a problem for you. It may not be a problem for everyone, because how you process caffeine is also decided by some of your genes. And some of you drink tea, I know, and some of you drink coffee. Coffee has a whole lot more caffeine than tea. So figure out whether caffeine is a problem for you. If it is not, go ahead and enjoy your cup of tea or coffee. So frequent meals and snacks is not a recommendation I suggest. But if at present you're eating a lot of carbohydrates, and particularly if you're vegetarian or vegan, it's many of my patients are vegetarian. In India, vegetarianism is something that is kind of cultural. They are vegetarians from birth, so it's not like they just decided to change now. So what ends up happening for a lot of people who are vegetarians is they end up eating a lot more grains and a lot more carbohydrates. And for someone like you, it is not easy to suddenly switch to less carbohydrates, because you're going to end up feeling hungry. So first and foremost, you need to up your protein intake. And if you eat non-vegetarian food, if you eat fish, meat, eggs, none of fish, meat, and eggs don't raise your blood glucose levels the way carbohydrates do. So first prioritize protein. When you serve yourself the food, first serve yourself the protein, then some non-starchy vegetables, and make sure you have good fat. So let us say you want to add some, olive oil, or you want to saute your vegetables in olive oil, or you want to add some ghee to the vegetables. that is a great way to add some good quality fat. So prioritize protein and good fat first. And then number one, there is very little space left in the plate to add carbohydrates. And more importantly, you will notice that you feel satiated so much more that you will not be able to eat more food. So you don't have to deliberately reduce your calorie intake. And you know that I never talk about low calorie diet. That is something that is just not the right thing for you. You need to fix your body's biochemistry to a point where you are not going to, number one, have to rely on your willpower to reduce your food intake or change the way you eat. So prioritizing protein and good fat keep you satiated longer, so you don't feel hungry as often, so that hangry monster doesn't get to work, so you don't end up getting all those symptoms which you have probably not even realized are a part of the way you eat or the way your blood glucose levels are functioning. So prioritize protein and good fat. And sometimes you may need to, you have to be observant about what works for you. Very often, if I am your doctor, I may not be able to tell you because I'm not there with you every day, all the time. And that is not my goal. My goal is to make you empowered to a point where you don't need my help at all on a day-to-day basis. You can figure out what is working for you and what is not working for you. And so try out a bunch of different food and see. So protein, again, decide which is your favorite protein and focus on that. And good quality fat. Fat will not make you fat, and fat will not raise your blood glucose levels as well. And I'm sure if you've heard me speak long enough, you know that fat phobia is something that has to go away. So reduce carbohydrates, and that is basically what you can do. And that ends my slide presentation. If you have questions, feel free to raise your hands, or you can type in the Q&A box or the chat box. And meanwhile, I am going to look for some of the questions that some of you had sent. The questions were related mostly to blood glucose levels. So this was in response to the email I had sent yesterday. Okay, there is one question. How about different millets in our diet? Very good question. So her question is, how about the different millets in the diets? Now, millets are again grains. Thank you very much. So millets are grains, and as I have said numerous times, grains can sometimes be very inflammatory for some people, and grains can raise your blood glucose levels very high. You've heard me speak before about, you'll find people talking about healthy whole grains. Now, whole grains may not be healthy for all. I have shared an infographic with all of you where it is mentioned clearly, healthy whole grains may not be healthy for all. So if you are wondering whether millets are right for you, number one is, I have, talked about the elimination diet before. And if you're my patient, you've gone through the elimination diet. So in the elimination diet, ideally, you need to eliminate grains as well. Number one, track your symptoms. Number two, see inflammation levels. You're not going to see suddenly coming down because you're not going to go to get a test of hs-CRP the next day after you stop your grains. So symptom would be number one. Number two would be, if you are someone whose blood glucose levels are not in the optimal range, then what you can do is, if you have a glucometer at home, check your blood glucose levels first before the millet meal. So you will know what it is before at baseline, then 1 hour and 2 hours after having that millet containing meal, and see where your blood glucose levels are. So, okay. I hope that answers your question. And if you need a follow-up response, please go ahead. Okay, so another question, this was emailed to me, was this was someone who has diabetes. So he asked, if my blood glucose levels go up after eating some food, and then I go and exercise soon after that, like go for a walk, and my blood glucose levels fall, is that okay? And now you know what the answer will be, because I talked about glycemic variability before. So Yes, initially, if this is the first time you're trying to get your blood glucose levels into the range, the target range that we have talked about, and target range is between 70 and 140. And again, if the upper limit is 140 and you have diabetes, obviously you need to have a conversation with your doctor, because it does not mean by adding 20,000 new medications. I'm talking about a lifestyle approach to manage your blood glucose levels better. So if your post-meal blood glucose levels are going very high, obviously the number one thing is you need to look at what you're eating. And if it is a food, and 95% of blood glucose fluctuations are related to food, a small percentage is related to stress and lack of physical activity. So if it is a food that is raising your blood glucose levels so high, why would you want to eat that? So you need to change, obviously you need to change what you're eating, but more importantly, is that something you crave? Because another thing that I have recently become aware of is food addiction. So there are some processed food, high carbohydrate food, which can make you addicted to them. So are you addicted to certain food that you feel deprived, you feel horrible, you feel you can't give it up? So in the ideal world, yes, of course, you don't want your blood glucose levels to go up more than 30 to 50 milligram per deciliter after a food compared to what it was before. For some people, they would don't want it to go more than 30, but some are a little more flexible. So let us say, what do I mean by that? Let us say before you started eating, your blood glucose levels were 100. And after eating your whatever you ate, it went up to 150. Is that acceptable? Yes, initially it is acceptable. And again, it depends. If you don't have any, heart disease or brain problem or kidney disease, it is acceptable, but it's not absolutely okay. And if you go for a walk, after that it comes down, that is okay too. But this wild fluctuation, I talked about the glycemic variability before, that is obviously not good for your brain. So you need to figure out how you can get your blood glucose more tempered down. Prioritizing protein would be, of course, one of the big things. And my Q&A keeps, mentioning there is, okay, is there any other way to find out if a food is causing inflammation other than blood glucose? Yes, blood glucose will not necessarily tell you about inflammation. So one way, like I said, is to find out from an elimination diet. And the other thing is, so this is what I recommend to many of my patients, particularly if they have, so at baseline, let us say your hs-CRP, which is a marker of inflammation. All my patients get that test done, and that test is available anywhere in the world. So if your hs-CRP is high, or your ferritin is high and you don't have high iron, what it's telling me is there is some kind of an inflammation happening. And what I recommend is after that, you go through an elimination diet. And at the end of the elimination diet, number one is from symptoms you can make out. Sometimes my patients say they feel the hands and joints are less puffy. They can fold their hands better, or they don't experience joint pain. The next is when you repeat your hs-CRP, quite often you will find that it has come down after you've done the elimination diet and found out what are your troublesome food. Now, hs-CRP does not go up only from food, but food is one of the commonest problems. There are some other tests which are not available routinely in a lab. They are available in research settings. There are things called LPS, lipopolysaccharides. Then there are triglycerides just after eating food. You can't get those tests done at home, just like, so even if your blood glucose levels don't go up after eating a certain food, it can still be inflammatory for you. So the only way is to symptoms after doing the elimination diet, and also your so blood markers other than CRP. Some of my patients have Hashimotos, which is hypothyroidism. They may find that their antibody levels have gone down after they have eliminated not just gluten, many of the other grains as well. So I hope that answers your question. Okay. So I'm getting a little confused. Why does it keep saying, okay, I have to click on answer live. And any other questions, or I can end this webinar early, and feel free to reach out with any of your questions if you have. Oh, you're welcome. Welcome, Janaki. And sometimes you may think of some question later on. Feel free to ask me then. And thank you so much for investing your valuable time with me here. Bye now.